How were these different studies able to treat scoliosis and rounded shoulders in just a few sessions? Why do you still have bad posture even after months of doing all the exercises your doctor gave you? Make sure to stick around to the end to find out. Adam here from trainmassage.com. And this first study is going to be for anyone who wants to improve their rounded shoulders in only 12 minutes. Yes, I said 12 minutes, not 12 sessions. This study started off with the goal of seeing if releasing the pec minor using soft tissue work and stretching it will not only help rounded shoulders, but also see a strength increase in the lower traps. Now, why the lower traps? Because this muscle helps create depression and retraction, which is pretty much the opposite of rounded shoulders. Now, to figure this out, what they did was take 28 participants with rounded shoulders and worked on them for about 3 days. Now, day one was all about getting the initial assessment without going through any sort of treatment. What they did was tested their rounded shoulders by having them lay flat on a bench and then measuring to see how far the acromion was to the table. And then they collected information on how strong the lower trap was as well. Now, day two was pretty exciting because not only did they go through those treatments, but after the treatment, most of them, or pretty much all of them, saw immediate results. Now, what they did was split this group into two groups, a placebo group and an experimental group. Now, that placebo group had someone pretend to massage the pec minor for 3 minutes, and then they taught them how to stretch the pec major for an additional 3 minutes. While the experimental group actually had their pec minor worked on for 3 minutes, and they were stretching the pec minor for 3 minutes. Remember, the experimental group was here to test if the pec minor contributed to rounded shoulders and lower trap weakness, not the pec major, which is why the control group got the pec major stretch and not the pec minor. But with all that said, here were the results. Participants in the experimental group, the ones who had work done on their actual pec minor and stretched them, actually showed a 13.3% reduction in their rounded shoulders compared to the control group. People in the experimental group also reported feeling immediate sense of relief and an increased sense of mobility. Now, with that said, both groups, the placebo and the control, actually saw an increase in the lower trap activity, even though there wasn't a big increase. Now, that's the end of day two, which brings us to day three, which is a simple follow-up 2 weeks later to see if any of these results stuck. Now, 2 weeks later, the experimental group, the one that actually had the soft tissue work, still showed a significant reduction in their rounded shoulders, even though the baseline did drop a little bit from a 13.3 to an 8.6. And both groups continued to show an increase in their lower trap strengthening, or their activity pretty much, meaning this experiment was a success. So as you can see, working on the soft tissues in the pec minor and then stretching it was able to help rounded shoulders in only 12 minutes. But why did stretching help with the lower trap activity, but not the rounded shoulders? We can find an educated guess in the next study here. In this study, researchers wanted to see if releasing the pectoral fascia would also help rounded shoulders. So here's what they did. What they did was take 36 people and tested the severity of the rounded shoulders, the length of the pecs, and the muscle activity of the pecs and all of the traps, meaning the upper, middle, and lower traps. After that, to test if their posture and their fascia was related, what they did was perform a mild fascia release on the pecs for about 4 minutes on one side, 8 minutes in total. After getting through all the participants and doing a final assessment, here's what they found. People with more severe forward shoulder posture, or rounded shoulders pretty much, saw a better increase in their rounded shoulders compared to those who have a weaker rounded shoulders, which does make sense, with the highest percentage change being around 15%. And what I find interesting here was that even though they did a fascia release on the pecs, the muscle length didn't actually really change, and neither did the muscle activation. So even though they performed a mild fascia release and saw an improvement in their rounded shoulders, the muscle still remained relatively the same length and the activity as well for those weaker muscles. So what do both of these studies actually tell us? It tells us that your fascia is what affects your posture, especially your rounded shoulders, which is why we saw an improvement in posture when you only worked on the fascia. But if you want to see improvements in the length of the muscles or even the activity, then that requires some kind of stretching. Fascia works on your posture, stretching helps the muscle. So if you want to see improvements in your rounded shoulders, then what you need to do is actually release the pec major and the pec minor for about 3 to 4 minutes using a myofascial release or a self-myofascial release. And then I highly recommend also stretching it for another 3 to 4 minutes just to help the muscle length and the activity of the other muscles around it. So with that said, if you're still not convinced that a myofascial release is the key to improving your posture, maybe this study about an 18-year-old girl with scoliosis will change your mind. In the study, the goal was to see if a myofascial release can help control the spinal curve progression of scoliosis in this 18-year-old girl. So what they did was conduct 30-minute sessions of myofascial release twice a week for about 6 weeks. And here's what they found. On a pain scale of 1 to 10, her pain would start off at a 6 and ended at a 2, showing a 67% improvement. And her spine range of motion and mobility also improved up to 33% in certain movements. All is pretty much showing that by performing a myofascial release, we were able to see an improvement in the mobility and all of that for someone with scoliosis. But this wasn't the only study. Now, the study was just on one person, but luckily we also have a review of different literatures. What this review did was take the evidence between myofascial release, back pain, and scoliosis and looked at them under a microscope with a comprehensive criteria. And from that, they found 17 different studies, including the one from our homegirl. Now, with all these different studies, all of them showed some kind of variation of a myofascial release or a self-myofascial release, with also some of them being combined with posture exercises. What they showed was that the myofascial release was effective for back pain and how it helps scoliosis in terms of the mobility, pain, and their quality of life. Now, I'm sure a lot of you may be wondering, if all this is true, then why are my doctors giving me exercises and not doing this? And I do believe it's because they were never really taught about the real fascia system and only mainly about the muscular system. Now, they obviously do know what fascia is, but I don't think they believe, or they at least know, how much it actually affects your posture and all the different things like the fascia lines, for example. You see, there are several fascia lines that go across the entire body, and not only do these lines cross more joints and areas than any other muscle, but they also can act like muscles and create tensions in these giant lines. So think of it as one giant muscle that includes all of your smaller ones that's constantly creating tension one way or another. And it's these giant lines that's most likely creating your bad posture, not the tight muscles inside of them. This is why doing your exercises isn't going to help your posture, because not only are they not responsible for your posture, as you can see from these studies, but even if they were, you're still trying to strengthen 1 to 2 small little muscles here, like the rhomboids in the back, in order to fight off all of that tension in the front created by your bad posture in the first place. This is why if you need to improve your posture and even your pain, you need to perform a myofascial release. You need to release the fascia. And if you need personalized help with that, then head over to trainingmassage.com, click on the contact page, and send me a message asking about my one-on-one training. As of right now, I can only take on 5 people at a time, so if this is something you're really serious in, then head over there and do that now. And for the rest of you who still want to see improvements in your posture, then make sure to watch the video up in this corner. I'll see you over there.